Welcome to V2 or Version 2 Allergy Management. Version 2 Allergies is a centralized allergy management tool which attaches the patient's allergies to their unique medical record number. This enables the patient's allergies to follow them with each visit to hospital. The benefits of V2 Allergies is enhanced patient safety with the shared allergy management system for all modules, and it also enables us to document a reaction for each allergy or adverse drug reaction event. If I am a nurse working in the emerge department and I want to document my patient's allergies, I will enter the EDM module, enter the facility that I work if I have multiple site access, click on my tracker board, highlight my patient, and click on my triage documentation tab. This will take me into my patient's triage and documentation screen, and emerge staff will notice that there has been a new header added. The header is called the Allergies and Adverse Drug Reactions header. By highlighting and clicking on the document tab, I will be launched into the allergy management screen. If I am a user that works on an inpatient or outpatient department and I want to document my patient's allergies, I will access them off of my patient's status board by going to the module, whether it's order entry or nursing, enter the facility if I have multiple site access, click on the status board where I'm taken into my list of patients, highlight my patient, and click on the allergy tab. Regardless of how I access the allergy management screen, the functionality and look remains the same. When you enter the allergy management screen, you will notice a patient header at the top of the screen. This field pulls the patient's demographics from the admission module based on their registration. This is a great double verifier that we are documenting on the correct patient. You will notice that the patient's name, age, and sex appears, what their current status is, what location they are admitted to, including their room and bed number, their unit number or unique medical record number, as well as their account or visit number. You will also notice that the allergy management screen is broken into two sections. The top section is called the Allergies for Interaction Checks or Coded Allergy section, followed by the Uncoded Allergy section. Uncoded allergies do not initiate an interaction check in the pharmacy module and should only be utilized or entered if there is not a coded allergy available within the pick list for the information that you would like to enter. Once an allergy is filed, you will notice the type of allergy that was documented, whether it's an allergy or an adverse drug reaction type, what severity their reaction was, the date that the allergy was last edited on, whether the allergy is in a verified or unverified state, if there is a comment attached, and what the reaction is. You'll also notice that an allergy will show in both its generic and trade name if applicable. To view the details of an allergy, the user needs to highlight the allergy that they would like to view, click on the View Details tab, to see what has been previously documented on that allergy. Once they have completed viewing, they click the Close tab and they are taken back into the allergy management screen. To enter a new allergy, the user needs to click on the New tab. They are taken into a search window and they can start typing the allergy. My patient states that they have a penicillin allergy. As I start typing in the window, you'll notice that the allergen dictionary shortens. When I notice the allergy that I would like to document show in the window, I can double click on it and it pulls it into the allergy adverse drug reaction window. Next, I need to document whether it's an allergy or an adverse reaction. The allergy defaults in, but I can easily change to adverse reaction if required. Next, I'll document the severity level of the reaction, whether it's mild, intermediate, severe, or unknown. This is based on the patient's history. If I file this field blank, the unknown severity level will default in. To the right, you will notice a verified status. The only users currently who have access to verify an allergy are our pharmacists and physicians. Next, we need to enter a reaction. When I click on the down arrow in the reaction field, the user is taken into the reaction dictionary. A reaction is required documentation for all allergies or adverse drug reactions, regardless of the documented severity level. Best practice is to choose a reaction from the pick list, but you do have the option to free text if needed. Also, if your patient doesn't remember, you may choose the unknown options. So I can choose an allergy reaction from my pick list, or I can free text, or if the reaction type is unknown, choose unknown. But it is always best practice to enter a comment as to why you are choosing an unknown reaction. I click on my comment field and I can enter a free text that the patient doesn't remember. The comment field is also a great spot to enter who you're obtaining your allergy information from if it is not your patient. And also it is best practice if you delete an allergy off of a patient's profile to enter a comment as to why you are removing it prior to deletion. Once I have completed entering my comment, I click on my OK. If I am done documenting my allergy, I can click on my OK tab one more time, and I am taken back into my allergy management screen. You will notice that the new allergy I've entered is a green color. Any new allergy or edited allergy for this session will remain green until I click on my File tab. The next two tabs on my allergy management screen are my Delete and Edit tabs. If I am deleting an allergy off of my patient's allergy profile, it is best practice to first edit that allergy stating why I am deleting it prior to deletion. To edit an existing allergy, I would highlight the allergy, click on my Edit tab, and update the appropriate information. Please note that at this time, the only information that may be updated with an edit is the allergy or adverse reaction type, the severity level, or a comment field. We currently cannot make an edit to the reaction field. If we need to make an edit to the reaction field, we need to delete the original allergen and input a new allergy, putting the correct or updated reaction type in. So based on patient's history, if a patient presents and they do not know the reaction type and we document unknown, but now with new information we know what the reaction type is, we need to delete this allergy, input a new one with the correct reaction type. Again, anytime you delete any allergen off of a patient's allergy profile, you must enter an edit under the comment field stating why you are removing it prior to deletion. So in my comment field, I'm going to state, for example, when I am cleaning up my allergy management screen and I am changing my uncoded to coded, I would, before I delete, enter a comment stating that changing from an uncoded to a coded status, or if I'm deleting off the profile and I enter a reason as to patient states they do not have an allergy to this, I would input my comment, click on OK if I'm completed, and the user must always file any edit made to an existing allergy prior to making a deletion. So I would file my allergies, yes, and now to delete that allergy, I would highlight my patient, re-enter the allergy management field, highlight that allergen, and delete. I will get a yes/no confirmation window to delete one of one selected. I will say yes. And when I have completed any edits on the allergy management screen, I would file and be taken back to this patient status board. This ensures that all of the edits and all of the documented data is attached to the patient's allergy profile. As a reminder, staff are always encouraged to click on the File tab prior to leaving the allergy management screen. By filing an edit prior to deletion, I can now in my audit trail look at the allergy I've deleted, and I can see that my text is there, and when I click on my edit text field, I can now see the reason as to why I've removed this off of the patient's allergy profile. If I do not file my edit prior to deletion, I do not see my reason for deletion under the audit trail. The Confirm tab allows the user to document that the patient's allergies have been reviewed.
All allergies should be confirmed on every patient on every admission, as well as confirmed with every transfer by the receiving nurse. The confirmation may be reviewed in the audit trail routine. So a nurse can select all once they've been reviewed, click on the Confirm tab. You get a yes/no confirmation box pop up to say confirm 5 of 5 selected allergies. The user states yes, and you have now confirmed your allergies. Anytime you do an input, edit, or any changes to your allergy management screen, prior to leaving, you should always click on your File tab. Confirmation, file your allergies yes, and you are taken back into your status board.
The Audit Trail tab takes the user into the audit trail of any activity that has taken place on this patient's allergy management screen. Please note that the information falls in a chronological order, and you can maneuver through the screen by clicking on your Next, Previous tabs at the bottom of your screen, or using your arrow up and down keys, or if you want to get to the most recent edit, you can click your F8 key to get to the bottom. When you're reviewing your patient's audit trail, it is very important to ensure that your patient's allergies have been confirmed for this visit. You will notice an edit under the New field that states that, that the patient's allergy list has been confirmed and the date and time of that confirmation. If there has been an edit made to any specific allergen, you will notice that there will be a check mark beside an edit under the text column. To view that edit, you just need to highlight that allergy or that activity edit, click on your text field, and you will see what has occurred during that comment. Once you are finished looking at the audit trail for this patient, click on the Close tab and you are taken back into the allergy management screen. The last tabs noted on my allergy management screen are my Select All, Deselect All, or Undo All. So the allergy management screen is a point-and-click environment. I can select all of my allergies if I want to do or complete a task related to all of my patient's allergies, for example, confirmation, or I can deselect all if I inadvertently selected them all and I only wanted to select one or two, or I can undo all. So if I've implemented changes to my allergy management or a couple of my patient's allergens, and then I realized perhaps I was on the wrong patient or I was editing the wrong allergen, I would just click my Undo All. I can also exit the screen without filing. Lastly, I'd like to remind users that if you have inputted new data on your allergy management screen, you need to file that information for it to remain on your patient's allergy profile. If I try to exit the screen without filing, I will get a warning asking, are you sure that you want to exit and undo all changes? I can return to screen and file. If I've entered something on the incorrect patient, I can exit and go back to my status board. To view my patient's allergies, you'll notice that I've added a new header or new column to the patient status board. So if there's a corresponding allergy to the patient's profile, you can highlight the patient and click on the Allergy tab to view. You can change your sort, or I can view my patient's allergies by clicking on my Review tab and I will be launched into clinical review. When I enter clinical review, you will notice on the patient summary panel that there is an Allergy tab. I can see my allergies here at a quick glance, or I can actually click here to launch into the allergy management screen. Physicians will view allergies the same way they have historically off of the patient detailed and patient keeper. The following are a few scenarios you may encounter post V2 conversion. If your patient's allergy management screen is blank, you need to ask your patient what their allergy status is. If they state that they have no known allergies, you can click on the No Known Allergy tab. It pulls no known allergies into the coded section and file. For the patient who has never been registered in Meditech before and have a blank allergy management screen, the user needs to enter the patient's allergies. If we are unable to obtain the patient's allergies at this time, based on patient status, the user may choose the Unobtainable tab. I click on the Unobtainable tab, and the Unable to Assess reaction pulls into the Allergy Adverse Drug Reaction window. If you are entering the unable to assess allergy, you need to enter a reason in the comment field as to why you're unable to obtain the allergy history at this time. Once I've completed, I can click on OK and file to the patient's allergy profile. If you have a patient who has been registered in Meditech before and they have allergies attached to their allergy management screen, but you're unable to review the allergies with the patient at this time due to patient status or whatnot, the user must trust that the past documented allergy information is true, and they will confirm the allergies based on this historical data or on another source, maybe a transfer form from another facility. Prior to confirmation, the nurse must edit the allergy indicating that the allergies are being confirmed based on past documentation. Once the edit is complete, the user will file it, Once I've completed my edits, I must file. To attach the edits to the patient's profile, then I'll return into the allergy screen, select all my allergies, and confirm. Once I've confirmed my allergies, I need to file to attach the confirmation to the patient's profile. Post V2 allergy conversion, I may notice that some of my patients have allergies that are falling under the coded status based on allergies that were inputted by the pharmacist in the pharmacy module pre-conversion. But a lot of our patients will have allergies falling under the uncoded allergy section, and this is due to the fact that we had free text queries on our past V1 documentation. So you'll notice that the headers are pulling over under the uncoded allergies, and inside of there, when I view details, I will see what was documented in a free text fashion prior to conversion. What I need to do post conversion is clean up all uncoded allergies, entering them into a coded allergy status, and then I need to edit and update all of the uncoded allergies, stating that I'm removing them from the profile because I've changed them to a coded status. So there is a bit of cleanup post-conversion the first time the patient presents. So viewing details again, this patient has environmental allergies. I grab it, the allergy type defaults in, severity level is not a required documentation, click on my reaction field and input my reaction. Click on OK. Now I can edit this allergy stating that changed to a coded status. Then I look at my next allergy and view the details, latex. So I'm going to input a latex allergy. It's an allergy type, severity not required. Click on my reaction type. Click on OK. I'm going to edit. Again, this is the latex. I'm going to edit that, stating that I've changed it to a coded status. Lastly, patient's allergic to contrast. I'm going to enter the contrast allergy. It's an allergy. Severity is not a required documentation field. It will file as unknown. Enter and edit, stating that I've changed it to a coded status. Click on OK and file. By filing it, I'm adding the new allergies and I'm filing the edits I've made to the uncoded. I file. Once I've filed, I need to re-enter the allergy screen and delete the old allergies that we've re-entered, and confirm the new allergies, and file. Please note that if you have a patient that presents with an uncoded allergy of yes, that data has came from the patient registration staff, and as they are not clinical people, they are not expected to actually input what the patient is allergic to. So it is up to us as the receiving nurse to actually delete that, verify with the patient what they're actually allergic to, and input a new allergy. If you notice when you're entering an allergy for your patient that is a food type, but you'll notice there's a duplicate allergen available in the dictionary with a drug or a food type, please choose a food type, and that information will pull onto a dietary report for our dietary staff. Input what the reaction is, okay, and file.
The following are helpful definitions related to V2 allergy management. An allergy is an exaggerated or inappropriate immune response initiated by exposure to an allergen, for example, drugs, foods, insect venom, or latex. True allergic reactions are uncommon, but when they do occur, they are severe. Adverse drug reaction is any unexpected or dangerous reaction to a drug, an unwanted side effect caused by the administration of such drug. The onset of the adverse reaction may develop over time and may, depending on the reaction, prolong hospitalization, result in persistent, significant disability or incapacity, be life-threatening, or result in death. A coded allergy is an allergy selected from the allergens dictionary, which will be checked for drug interactions when orders are processed in the pharmacy module. An uncoded allergy is an allergy not listed in the Meditech Allergens Dictionary, which may be added in a free text format. This allergy will not cause an interaction check in the pharmacy module and should be avoided unless absolutely necessary. No known allergies. No known allergies is a coded allergy entered when the patient reports that they have no known allergies. Unobtainable allergies. Unobtainable is a coded allergy entered when it is not possible to ascertain the patient's allergy status. There will be no interaction checking in the pharmacy module. The healthcare professional must update the allergy status as soon as possible to reduce the patient's risk of exposure to a potential drug, food, or environmental allergen. Allergens Dictionary is an extensive list of medications, environmental agents, foods, and other substances to which a person may develop an allergy. The list is maintained on the Meditech Hospital Information System and is periodically updated by the hospital's formulary service vendor to ensure that the most recent medications are included. Severity, or severity level, is documented as one of 4 levels, which are mild, intermediate, severe, or unknown. Mild is insignificant, no harm done, and no treatment needed. Intermediate requires treatment or necessitates hospitalization due to rashes, hives, swelling, or difficulty breathing. Severe is a life-threatening allergy or anaphylaxis causing permanent harm or death. And unknown is defined when a patient cannot recall or remember. A reaction is a patient's response, for example, rashes, hives, or swelling, experienced by the patient when exposed to the allergen. Reactions may be selected from the reaction dictionary on the allergy screen, or may be entered as free text if the patient reports a reaction which is not in the dictionary. Confirm is a routine within the Meditech allergy entry screen, which signifies that the allergy information has been reviewed by the healthcare provider for that patient. Selecting the Confirm button simply updates the audit trail history with documentation that the user saw and confirmed the allergy. A patient's allergy should be confirmed on every admission by the admitting nurse and on every transfer by the receiving nurse. Allergy Audit Trail. This records all electronic access to the allergy information and can be viewed through the allergy screen, pharmacy module, Meditech patient care inquiry module, and/or clinical review. A downtime is a time interval, either planned or unplanned, during which the Meditech Hospital Information System allergy record cannot be accessed at the point where the information is required. Temporary hard copy reports will be available during downtime. All information documented on a hard copy report should be inputted electronically once the system is functional.
This concludes our V2 Allergy Management e-learning package. If you have any questions regarding V2 Allergy Management, please feel free to enter a task at www.serviceanywhere.com, or if it is an urgent issue, you can call the help desk at extension 2222.